So Sandra Garcia, and I'm talking about the therapy to prevent gastric cancer. So let me start by saying the definition about gastric cancer. Early gastric cancer is defined as invasive gastric cancer that invades no more deeply than the submucosa, irrespective of lymph node metastasis. The incidence of gastric cancer is highest in Eastern Asia, Eastern Europe, and South America, and it affects twice as many men as women. Risk factors for gastric cancer include Helicobacter pylori infection, cigarette smoking, and high alcohol intake. Patients with early gastric cancers that are limited to gastric mucosa or submucosa usually have an advanced loss of mucosal glandular tissue, glandular atrophy, and are at high risk for subsequent metachronous development of new gastric cancer.
Helicobacter pylori is a widespread bacterial pathogen and major cause of gastric cancer. However, it's not known whether patients with early gastric cancer who are undergoing endoscopic tumor resection would benefit from H. pylori eradication in an effort to prevent subsequent gastric cancers. In a double-blind randomized controlled study conducted at South Korea's National Cancer Center, 396 patients with early gastric cancer or high-grade adenoma who were undergoing endoscopic tumor resection were randomized to receive H. pylori eradication therapy or placebo. During a median follow-up of 5.9 years, subsequent gastric cancer was identified in 27 of 202 patients in the placebo group, but in only 14 of 194 in the H. pylori treatment group, approximately one-half the rate. Patients with successfully eradicated H. pylori had approximately one-third the rate of subsequent gastric cancer. In addition, histologic analysis of precancerous gastric mucosal atrophy at baseline and 3-year follow-up showed atrophy grade improvement in 48.4% of the H. pylori treatment group as compared with 15.0% of the placebo group. No serious adverse events were documented. The authors conclude that even in patients with gastric cancer with severe histologic changes, H. pylori treatment significantly improved gastric mucosal atrophy and reduced subsequent gastric cancer development. Full trial results are available at nejm.org.
Helicobacter pylori eradication has been one of the major therapeutic strategies to reduce gastric cancer incidence in healthy individuals and gastric cancer patients who have undergone endoscopic mucosal resection. A meta-analysis shows that Helicobacter pylori eradication is associated with a reduction of gastric cancer risk even among high-risk individuals, supporting that Helicobacter pylori eradication is beneficial in individuals with atrophic gastritis and or intestinal metaplasia. First, almost all gastric cancer patients have atrophic gastritis and or intestinal metaplasia. So this meta-analysis showed that eradicating Helicobacter pylori after endoscopic resection of early gastric cancer reduced the risk of metachronous cancer by 54%. Second, a population-based mass eradication program on Matsu, island of Taiwan, found that Helicobacter pylori eradication could reduce not only the severity, but also reverse the presence of atrophic gastritis among subjects with premalignant gastric lesion at baseline and reduce gastric cancer incidence by 25%.
There were 4 studies containing 6,301 subjects which provided data on mortality from gastric cancer. Follow-up in these trials ranged from 5 years to 22.3 years. Overall, there were 36 deaths from gastric cancer among 3,154 healthy infected individuals randomized to eradication therapy, compared with 59 deaths in 3,147 participants allocated to placebo. The relative risk of death from gastric cancer with eradication therapy compared with placebo was 0.61. The number needed to treat was 135. However, there was no effect of eradication therapy on all-cause mortality. When we pooled data from the 3 trials conducted in patients with gastric neoplasia, there were 41 future gastric cancers occurring in 910 patients randomised to eradication therapy, compared with 87 in 931 patients receiving placebo or no treatment. The relative risk of a future gastric cancer with eradication therapy versus placebo or no treatment was 0.49, with no heterogeneity between studies. The number needed to treat was 21. Mortality data were reported incompletely by these trials. To summarise, mass eradication of H. pylori reduced future incidence of gastric cancer. The number needed to treat to prevent one gastric cancer decreased from 124 overall in our previous meta-analysis to 72. In addition, eradication therapy was associated with a significant reduction in gastric cancer-related mortality in healthy individuals. The number needed to treat to prevent one gastric cancer-related death was 135. There was no effect on all-cause mortality. The effect was even stronger in individuals with gastric neoplasia. The number needed to treat with eradication therapy to prevent one future gastric cancer was only 21. This meta-analysis provides contemporaneous estimates of the impact of eradication of H. pylori on both incidence of and mortality from gastric cancer, which can be used to inform future public health decisions.
Now, pros and cons. I think that in order to establish pros and cons, we need to settle up the importance of the survival rates with and without the Helicobacter pylori treatment. So what are the prognoses without treatment? An early report from Japan suggested that without treatment, 63% of patients with early gastric cancer will progress to advanced stage disease within 5 years. Early gastric cancer may represent a meta-stable biologic state with doubling times on the order of several years versus advanced cancer with doubling times of less than a year. On the other hand, the prognosis following treatment, the overall 5-year survival rate for treated early gastric cancer is over 90%, nearly 100% for mucosal tumor and 80 to 90% for submucosal tumors. Survival rates are similar between patients who undergo endoscopic resection and those who undergo surgical resection, and the recurrence rate after surgery is approximately 1 to 5%. There have been some reports that says this treatment regimen increased the risk of short-term cardiovascular mortality. Issues applying in Ecuador. In Ecuador, in 2017, gastric malignant neoplasia ranked 6th among the causes of general mortality with 1,647 deaths, according to data from the National Institute of Statistics and Censuses. We examined whether Helicobacter pylori eradication therapy in asymptomatic individuals, and the results we got were the same as those I mentioned in the presentation. It was shown that there is a reduced risk of gastric cancer in the eradication therapy group. Conclusions. Stomach cancer is the 3rd cause of death in the world in both sexes. And actually in Ecuador, stomach cancer occupies the 1st place of incidence in both sexes. It is important the early diagnosis and treatment, bearing in mind that by doing this we can reduce morbidity of this well-known cancer.